Hi, I'm Dr. Martin Rutherford. I'm certified functional medicine practitioner, chiropractor also, in practice since 1979.
Dr. Randall Gates, board certified chiropractic neurologist, as well as being a chiropractor.
And we probably made the mistake of going to the movie Concussion the other day. And it was very, very interesting to me. And I'm sure we both had different and similar viewpoints on it. But as you sit and watch the movie, for those of you who don't know what it's about, it is about concussions that are caused by repetitive injuries. And of course, the two top sports for that are boxing and football. And the movie is essentially about a certain group of doctors' efforts to show that there is indeed scientific evidence that repetitive hits to the brain in football and previously acknowledged in boxing cause damage to the brain. And so it's really a very interesting movie. It's the old movie of if you do the right thing, watch out, it might come back to bite you, that type of thing. It's a very controversial subject because it's being made so. And so we may or may not be treading lightly here. For me, it just struck me as to how many of the symptoms that, and it's a real story. They even used the names of the real football players that were that they did autopsies on, and the slices of their brain and so on and so forth. And it just struck me how similar so many of the symptoms are to the patients that we treat, the chronic pain patients who come in with mood disorders, and they come in with memory loss, and they come in with depression and hearing voices. And I mean, we see this. And it's why part of the reason we do such a thorough screening process. And we work as a team with other doctors, particularly in more severe cases. We actually work with a functional psychiatrist. We work with a clinical hypnotherapist. We work with an osteopath so we have a team that we don't all work on every case, but on these cases, it can really get hairy if you don't appreciate what you're working with and you don't have a team who's all working together on this. So it was interesting to watch it from the perspective that we have treated these patients. Dr. Gates has a much more thorough background in brain neurology than I do. But we've been doing this for a long time, and so we as you watch it, you kind of have opinions on it because you listen to what they say, and sometimes it fits with what you've seen, and sometimes it doesn't. And in this particular case, a lot of what the people who are saying that these injuries don't occur very often in these sports was saying really doesn't fit well with what we see. Now, please, we've already got it. We talked about concussions a couple of weeks ago. Don't start sending us stuff saying we're anti-football. We want it. Dr. Gates is an ex-offensive lineman. Okay. I'm all over as I like to watch football highlights where the concussions happen, right? but I love to watch football highlights. I just don't have enough time to sit there and watch football. My dad was a big Pittsburgh Steelers fan. I was a Dallas Cowboys fan when I was a kid, and Oakland Raiders when I was a kid. But you got to look at what's going on, and I would discourage my son. I would discourage had he asked to play again, I would have discouraged him from playing on the basis that I started to see a lot of my young patients who are in their 20s and late 20s having severe neck degeneration in vertebrae in the neck that shouldn't be appearing until at least 35, but generally the type of the degeneration I was seeing, the type of degeneration I was seeing, these people shouldn't have been having until they were like 55. Okay. And I started looking at that. And at the time, we didn't really understand a lot about the brain, but now we even know that type of degeneration interferes with feedback mechanisms to the brain and so on and so forth. That was way before. I mean, we're talking 20-some years ago. That was way before we started having the concept that that banging heads at 60 miles an hour may, for a career, may not be a good thing. But I do remember, I actually worked with the local police and firemen when they had their football league, and I'm in Reno, so we would play Oakland, we would play San Jose, we would play Sacramento. Our police and football teams would go together. Our police and our firemen would go together, and we had a lot of good football players. In fact, Frank Hawkins was our coach, who played for the Raiders. And I just remember standing there when they would snap the ball. I didn't play. I was like support staff. I was there to fix people, and I just remember when they snapped that ball, and those guys started banging heads. I thought, wow, that is something I would never want to do. And this was before any of this was happening. So look, this is not about we hate football or anything. It's not. It's just we're just going to present something to you that we feel is very important. I almost hesitated to do this. I'm not a big controversial guy anymore. I kind of like living a nice, peaceful, quiet life. But the facts are the facts, and we're going to give them to you the best as we know them today, both scientifically and clinically. So preventing further brain damage in contact sports, and a review of CTE, which is chronic traumatic encephalopathy from repetitive hits. There's so much more to it than what's even was in that movie.
Oh yeah.
Okay, and we're going to kind of give you that, and how if you do have that, and again, for those of you who watch these, I've had 9 concussions and counting. The more I think about it, sometimes, but for sure, I have had 9 concussions, and I am so much better than I was years ago. Than when Dr. Gates walked in here 6 years ago, for sure. I'm like enormously better, and so we're going to share some of that with you, because I'm not the only concussion patient that we've had here, not by any stretch. So let's first talk about chronic traumatic encephalopathy. You would like to start by defining the problem.
Exactly.
Was that a little too much?
No, that was good.
Did I give you too much now? Now you're thinking about 10,000 more things.
Right. This is a big issue.
It is.
This is a big issue. And the reason why we're so passionate about this is because, yes, people are hitting their heads playing football, getting kicked in the head playing soccer, MMA, boxers, MMA now as that explodes onto the scene. Head injuries are happening, and they're probably going to keep happening in all reality for God knows how much longer, but they're probably going to keep happening. And our whole stick is, how can we prevent the further degeneration of the brain after these head injuries have happened? Right. So, people are going to play football for however long they can play, but then it's their post-football career which really becomes important based on the current literature. And that's what we want to highlight. With CTE, anybody who's watching this broadcast today and you haven't seen the movie Concussion, you got to see it. You just got to see it. It was really well done. We're not picking sides. We're not anti-NFL. No. We're not, pro, nobody ever hitting their head again. Maybe we're, but we're trying to stay in the middle, but then using the objective data to help people get better who have these symptoms, so that maybe we can prevent people from going through the horrific experiences like some of these former boxers and NFL athletes have gone through and their families.
Yeah.
So with head injuries, it's estimated that like 100,000 to 300,000 concussions occur a year just in football. And what we're finding is that it doesn't even have to be concussions. It can be these repetitive subconcussive hits, as Dr. Rutherford said. Continually banging the head can be damaging to the brain, and that's what we're now seeing.
What is a subconcussive hit?
So you don't get a concussion. A concussion is where you hit your head, you may black out, you may not black out, you may lose consciousness basically or not, but then you'll feel disoriented, you may not know where you are. The classic example of the player running into the other huddle or the boxer going into the opposing corner, not knowing where he is. And then you can have symptoms after that where you're just disoriented, your concentration is off, you can't think, maybe you feel depressed. And after a concussion, those symptoms can go away in like a week, or they may not go away in a week. And when they don't go away, that's where we get into this realm of post-concussion syndrome, where people have those symptoms that I highlighted, but lots of times they'll have headaches and they'll have dizziness. Within the field of neurology, and I'm kind of summarizing stuff that we've talked about in other broadcasts, if you have a head injury, if you've had multiple head injuries and you're curious on this topic, you need to go back on our website, powerhealthtalk.com, and watch every video we've done where we even mention concussion. And with post-concussion syndrome, which is where people would have these, continual neurological symptoms, they were almost laughed at by the neurological community. We may get some flack on that, but I can show you in textbooks where the chief neurologist writing the textbook would say, nothing's wrong on their MRI scan. Nothing's really wrong on their CT scan. Their neurological exam is basically normal. And we think these people with post-concussion syndrome are faking it because they're trying to get money out of the organization that they were playing for, or from a work comp related injury, meaning you fall at work, you hit your head, and now you got all these symptoms. You're just trying to get money from the company. That's how it was phrased.
Enough, our fibromyalgia patients frequently hear the same.
Oh yeah, exactly. Well, there's some similar mechanisms going on in the background.
My point.
Between these two things. Exactly.
Eventually, I think we'll get to that point.
And so this point was even highlighted in the movie, and it's not really the neurological community's fault per se, because the scans were normal. The brain scans are normal, and these football players.
The autopsy was normal.
The autopsy technically,
autopsy
was technically normal of the brain.
Normal.
But you have to dig a little deeper to see what's going on. So that's kind of the framework of the post-concussion syndrome. Now, with chronic traumatic encephalopathy, it was definitively diagnosed. It was kind of a scientific achievement, so to speak, by Dr. Bennett Omalu. In the movie, they profile how he was kind of a doctor who was profiled to be a quack because he came out against a big organization with this finding. But he deserves a ton of the credit because he dug deep and investigated why a former football player was having these odd neurological symptoms, though, as Dr. Rutherford said, his brain weight was normal, his CT scans were normal, and Dr. Omalu was a neuropathologist, so he took little brain slices, and when he did that, he saw findings very similar to Alzheimer's disease, not exactly similar, and that's where I want to kind of draw the line here. So with Alzheimer's disease, and for those of you listening on our podcast, you won't be able to see this, but we'll just use a little visual imagery of the brain. Maybe look at a brain online. And with Alzheimer's disease, it primarily affects the memory area of the brain, which is deep in the center of the brain, called the area of the medial temporal lobes. And with Alzheimer's disease, I'm going to use a few specifics. Okay, I try not to do this, but I have to do this here. With Alzheimer's disease, we see these things called beta amyloid plaques, and then these other neuropathological signs called neurofibrillary tangles. Just think of it as the structure in your house is not correct. So think of you having like sheetrock in the middle of your living room just sitting there, or you have 2x4s sitting over your stove, so you can't use your stove correctly. These things I just labeled, the beta amyloid plaques and the neurofibrillary tangles, are like that. What Dr. Omalu saw is he didn't really see a lot of beta amyloid plaques, but they saw a lot of neurofibrillary tangles.
Right, you mentioned that.
Okay. In the brain, and they saw it in a different area. They saw them basically throughout the brain, whereas in Alzheimer's disease, it's just in this medial temporal lobe area. The CTE, or chronic traumatic encephalopathy, for the record, you can see beta amyloid plaques, but not always. They saw a lot of these tangles in other areas of the brain, particularly the areas of the brain that were hit possibly by the repetitive head injuries. So that's kind of the overview on CTE. We're going to get into a lot of specifics, but what they started identifying in these athletes who once were referred to having punch drunk syndrome. These were boxers back in the late 20s and early 30s who just looked like they were drunk all the time. And really what was going on is that it was this chronic traumatic encephalopathy process going on in their brain, such that they would have mood disorders, they would have paranoia, they would suffer with depression, they would have other problems moving, such that they had bad balance, or they had dizziness, they had deafness, they may look like they had Parkinson's disease, like one of our most famous fighters. I think everybody knows who I'm talking about.
Yeah.
And so in essence, when the brain is hit so many times and we start to get this process of these neurofibrillary tangles in the brain, then we get degeneration of the brain, and it can involve many areas of the brain. So it can involve dementia. It can involve your ability to make good sound judgments, your frontal lobes. It can involve your ability to think, your frontal lobes again. It can involve your balance, your cerebellum. It can involve the part of your brain that makes dopamine. Parkinson's. So that's the overview.
And I would say, I would add to the overview for those of you who may be out there and still, despite my preamble is saying, look, we're not against this, we're just for the facts. Part of the problem in getting this understanding out there that it's as widespread as it probably is that you cannot diagnose this unless you do an autopsy and people allow you to look at their brain, and then somebody does the slices and they look at them. And so we're gonna have to wait for another 1,000 NFL football players to die and will their brains to science before the doctors who have discovered this and are aware that it's going on are able to say, I have this long study and I have all these types of things. So that therein lies the controversy. The other elements that we're going to go into now is some people probably get hit and experience this worse than others. There are reasons for that. And along those same lines, there are reasons why those same people that get hit and feel it worse than others or experience the symptoms worse than others also are the ones who ended up in this movie. Dave Durson, Mike Webster, who the whole movie was really cornered on in the beginning. These are famous football players that committed suicide. Junior Seau, whose nephew plays for our local football team.
Oh, I didn't even know that.
Oh yeah, he was player of he was like first team defensive lineman for University of Nevada Wolfpack. Go Pack. Yeah. So yeah. Oh, you didn't know that?
I did not.
Oh my goodness, that's funny. Yeah, he plays right here. So yeah. So let's talk about maybe. I wanted to go into that before you got maybe into high school football players.
Okay.
About the fact that you have to do there's a lot of controversy on this. Okay. In old school diagnosis, and if we knew that there was such a thing as this and a person was walking around and they had their bell rung, we would say, hey, you got a concussion, we need to do something about it. But nobody knew. And the first that I started to understand about this was working with whiplash injuries. And my first exposure to it was with Dr. Art Croft, who is authority, I would say, and researcher, by the way, in motor vehicle accidents. And he started to accumulate all of the data on mild traumatic brain injuries. People who get hit from behind in a car, there's no damage to the car. The person's head goes whacking around like this, which you can really see in slow motion photography. And the person has all the concussion symptoms in the world. And the insurance company is saying, you don't have it, you're faking it, you just want it. Meanwhile, the person's walking into the room. They can't remember why they walked into the room. They forget what their keys are. They forget where their car is. And maybe in a month or so, maybe in a week, maybe in 10 days, maybe in a month or two, the symptoms go away. But those people were getting mild traumatic brain injuries that didn't show up on any of these scans. And as they explained in the movie, and I may be stepping on your part here, the brain actually is kind of in a fluid, and it can go back and forth and cause an injury without it becoming damaged to the cranium. And I'm sure I'm not all the way on that as much as I should be. But the point being, that's kind of when I became aware of it, was in the early 90s. And that was before they started making the connection with people who were offensive linemen in the NFL, or people who were boxers in the 20s, 30s, or 40s, or I'm sure hockey players who are getting their teeth knocked out. And they're probably not as much, but still,
yeah.
You know, it's repetitive.
Hockey's dangerous.
Yeah, hockey sure. and even heading
soccer
and heading soccer balls. So I mean, we're not talking about eliminating all this. We're talking about saying, here's what may be why you might get symptoms from it more than somebody else. If you do get symptoms from it, either way, there are ways, there are things that can be done. Instead of just arguing over it and slapping a bunch of drugs on people, there are things that can be done to help you. And I mean, I tell you, I'm living proof of this. So
you are.
So yeah, if any of you know me And there are people out there watching it know me from even 6 years ago. And you really think about it, you'd have to know I'm way more articulate than I was. My energy levels are much better. I'm thinking much better. I'm studying again. At 63, I'm studying like I was like in high school again and getting things done. And it's been pretty amazing. Dr. Gates, the first time he did a neurological exam on me, I was testing to see if he knew what he was doing when he came in there. And from the look on his face, I knew he knew what he was doing, because he was going like, how do I tell this guy his brain is really screwed up? and thus our relationship began, and here we are. So let's go on to that. Let's go on to that. And if you want to talk about high school football players, I don't know if you want to go there.
I do. That needs to be highlighted.
But do that, and then we want to go on to what's the solution for those of you who may be watching this. Maybe you're an NFL football player sitting out there going, they're going to give me money. They're not going to give me money. It's not enough for me to get well, and all that type of stuff. There's help. There's help.
Yeah. I'll start with the high school football players, and I'll go into what you said.
Yeah.
So the really disturbing part of this whole CTE discussion is that now it's been confirmed in 6 high school football players. So we're talking high school football, which the speed of impact is dramatically different from college, and it's vastly different from the NFL and the forces involved. And so we're seeing that those forces just in high school football players is enough to create the signs of chronic traumatic encephalopathy. I just read an article where they confirmed it in a 25-year-old football player. So we're now seeing that this process can start early. And this dovetails into, we have mounting evidence there versus the burden of scientific proof. The burden of scientific proof is such, like what Dr. Rutherford said, we need 1,000 NFL football players and boxers to die. We can examine all their brains, and then we'll have a sample size large enough to definitively say that these head injuries are causing chronic traumatic encephalopathy, and we need to do something about it. That's probably 20 years away, at least. At least. And we see the same problem across the board with a lot of our chronic pain conditions. We want to do one thing and do a longitudinal study or a sample study and then a longitudinal study. That's going to take 17 years before this one little medication or therapy is going to be implemented.
For fibromyalgia.
Yeah, for fibromyalgia or peripheral neuropathy as an example. So there's a big lag there. And then you have the clinicians who are on the front lines. You have the family members who are on the front lines. And that's who we're talking to, because the data is now becoming overwhelming, demonstrating what's going on with these repetitive subconcussive hits, what happens to the brain, the inflammation that ensues, and then why the inflammation keeps going throughout the person's life, ultimately resulting in symptoms of chronic traumatic encephalopathy. Or maybe you don't get chronic traumatic encephalopathy, but you have mild cognitive impairment. So you don't have like Alzheimer's brain, but you just can't remember things, you just can't think well. Well, that's a problem too. And maybe you're depressed. Yeah. We talked about it 2 weeks ago in our broadcast on, I think it was concussions and homocysteine. If you have concussions, get your homocysteine checked. And new data is now showing that basically in college football players, the memory area of their brain starts atrophying. It's inflamed, like at that point in time. And we talked about
growing
last week,
smaller.
It's smaller.
Their brain is growing smaller.
Their memory area. And last week we talked about with depression, aside from antidepressants, the critical component with depression that we're now finding in the neuroscience community is the memory area of the brain starts to shrink. When the memory area shrinks, the fear center of the brain enlarges, and that creates a stress cycle in the body that ultimately results in depression. Watch our broadcast from last week. One of the critical factors with all these, these football players and boxers and MMA people and soccer players is that they can develop depression after these head injuries ensue. I'm hesitating because I'm just not trying to emphasize football. I'm not trying to pick on one sport.
Yeah, I would venture to say that most of our chronic pain patients, whether it's chronic migraines, vertigo, dizziness, balance, whether it's chronic restless leg, whether have this mechanism going on from some, well, we've talked about the emotional traumas, but now we understand it's not just being verbally or physically or sexually abused, but it can be caused by repetitive trauma to the head.
It can be. So there we go into, do we have an imaging solution? So everybody, we talked about the scans are normal, the MRIs and the CTs are normal. Scientists have been working on delineating, is there a different way we can do these brain scans to see what's going on possibly with CTE? There is some potential hope on the horizon. They're seeing that with different imaging modalities. I don't think I need to go into it. Do you think I need to go into it? I don't think I need to go into it. I can talk to you about the specifics here, but we have some possibilities on the horizon with positron emission tomography, diffusion MRI, some studies such as that are showing that maybe we can predict which football players, which boxers are going to get chronic traumatic encephalopathy. So now we're to the meat and potatoes. This is the whole point of the broadcast. How do you prevent further damage? In order to know how we're going to prevent further damage in the brain, we need to know what the problem is and what's going on. I don't know if you want to interject anything at that point before
I might add, you know, sometimes my mind will drift because I'm trying to like think ahead, and so I don't know if you said, and so thus you kind of have to go back to old school diagnosis at this point. You have to embrace the fact that there is such a condition, and then you have to look for the symptoms, and then you have to do the exam, and if the exam and the symptoms correlate, there is no real way that has been accepted right now except an autopsy of the brain, and so you have to treat on history and exam, and the exams really aren't being done as maybe,
Great point.
as frequently and maybe as thoroughly as maybe they could be, and it's maybe because the condition itself is not even being embraced. So they might be wondering, like, how are you going to treat me when
everything says I'm normal? That's an awesome point.
Right.
And that's where we give credit to Dr. Carrick. Dr. Carrick came up with this field of functional neurology. That is what I do as a board certified chiropractic neurologist. And that's where, for example, in a medical neurological exam, if you stand with your feet together and your eyes closed and you don't fall over, the test is considered basically normal. Whereas Dr. Carrick said, well, this person didn't fall over, but he swayed pretty dramatically to the right and his balance was off. And then I put him on a foam pad and now he falls over. And we know what that means to the balance center area of the brain. So maybe he has a problem in that balance center. And can I do exercises? Just as a soccer player would exercise their legs, we can exercise certain areas of the brain. We now know this. So could we go in and exercise that balance center and get it functioning better? And so that's where Dr. Carrick became a pioneer in the head injury world and really the neurological world.
And relative to concussion and getting it better, it really doesn't matter what caused it.
Right.
There's certain parameters that the brain needs to function normally, and ultimately when they're interfered with, there are certain things that need to be done to get it functioning normally again, no matter what type of a concussion that you've had. And so once you've established where the brain's not working relative to the concussive hits, then you can go after that brain with the work that you're talking about, and then you can get the environment improved, which you're going to talk about much more specifically.
Right, exactly. And then the underlying metabolic environment as to why that brain chemistry is so messed up is where Dr. Rutherford brought his piece of the puzzle, and that's where we combine these two. Because if you address the brain chemistry aspect or the inflammation with rehabbing the brain, that's where we see really cool changes. And that's why Dr. Rutherford is a different guy today than he was 7 years ago when I met him.
I mean, those guys that they were highlighting in the movie, by the time they started to cut into their lives, I mean, these guys they were drinking, they were taking all kinds of drugs. The one guy was doing airplane glue, sticking in it. He was, this poor guy, his brain was gone, and he was pulling his teeth out, harming himself, and then trying to stick them back in with the airplane glue. Now you got airplane glue in there affecting chemistry of the brain. You have to assume that maybe there was some drugs or alcohol involved before that. And all of these things have to be factored in to the severity of the ultimate result of that concussion. So they didn't say that in the movie, but as we were watching that, I thought, okay, they picked some extreme examples, and I get it. And these people were hearing voices, and they were doing, but we have people coming here who are hearing voices, you know. So, so the environment that you have in your brain before you get hit is important relative to how that concussion is going to progress. And then that environment has to be addressed in addition to strengthening or calming down the different areas of the brain that need to be strengthened or calming down. And that environment can be altered. It can be.
Exactly. So now let's go into a brain injury. We hit the head. Let's say Dr. Rutherford's an immune cell in the brain. They're called microglia. And when the brain is hit, the microglia go from being basically on vacation, in terms of ramified microglia, to saying, uh-oh, we got inflammation here. So Dr. Rutherford is going to basically expand in size by twice the size. He's going to be blown up. And then he is going to vomit out inflammatory chemicals that's going to attract other immune cells to basically come and clean up the area. Just like spraining your ankle. You sprain your ankle gets swollen. That's happening because your immune system is going there to try and repair the damage and clear debris out. Except in the brain,
which has a different immune system from the rest of your body.
Completely different, and it has a different way of operating, to where once it creates the inflammation, then these brain cells, these brain immune cells like Dr. Rutherford, are going to turn themselves off and then start repairing. So they go into like inflammatory mode, and then they calm down and they say, okay, let's repair everything. It's beautiful, it's perfect. The issue becomes what we term the second impact syndrome, but then we have these subconcussive hits where you can be hitting your head, I don't know, hundreds of times in a football game.
If you're an offensive lineman, they highlighted the center of the Pittsburgh Steelers who had played for 17 years. And I forget what the estimation
football,
was.
Right?
Professional football for 17 years. Yeah, I forget what the amount of concussions he estimated that he
like 70,000 head hits.
Yeah, like 70,000 head hits over those 17 years.
So the issue becomes is that these brain immune cells don't turn themselves off then. So then they stay fat and enlarged, and they keep vomiting out these inflammatory chemicals. That's when you're in problem. And they've shown that this can remain that way for months after a couple head injuries.
And whatever parts of the brain those chemicals start to affect, you start to experience the symptoms of that part of the brain losing function. Does that make sense? That's how it works. It's pretty straightforward.
Perfectly said. So now your frontal lobes are gone, so you can't think, you're not making good decisions. Your temporal lobes, medial temporal lobes are gone, so you can't remember. Your cerebellum's going, so your balance is off, and you're dizzy when you tilt your head back.
Yeah, because eventually the inflammation can find its way everywhere, but it doesn't find its way to the same places in any two people. So you get different symptoms, and everybody in your family thinks that you're crazy, and they think that you just got emotional problems and that you need to go see a psychiatrist. And you probably do need to go see a psychiatrist or a psychologist if you get to a real severe point. But
and then what happens is that once these immune cells don't turn themselves off, then the brain goes into the state. This is the newly proposed theory of what's going on in these multiple head injuries, of excitotoxicity. So basically the brain is exciting itself and not shutting itself off. And so with this, we get receptors. We've talked about neurotransmitters, which are just brain chemicals that go from one brain cell to another and tell this brain cell to do something. Well, the neurotransmitter works by binding to a receptor. We get all these new receptors coming up to the surface of the brain cells for this excitatory neurotransmitter called glutamate. Does that make sense? Should I explain that in more detail? I always look at him because I'm trying to bring this down like 8 levels so that everybody can get this. So just know that your brain just keeps exciting itself, and that keeps going. The other issue becomes that, and we talked about this 2 weeks ago, but we're going to go into more detail now. The immune system in the body, which is separate from the immune system in the brain, it starts going into the brain now too, and saying, oh, what's going on here? Oh, there's a lot of inflammation. And so they go back out of the brain, back to the lymph nodes, and they say, guys, we got inflammation up there. We need to start attacking things. So now we start making...
Lymph nodes are where a lot of your immune system resides.
So now we start making things like antibodies, little immune missiles to parts of our brain. But more specifically, this inflammation in the body, and inflammation in the brain, can be perpetuated by a few things. One thing they're finding is that inflammation in the vagus nerve. The vagus nerve sends a lot of signals to your digestive tract, and it carries signals from your digestive tract. We're finding that if there's a lot of inflammation here, there can be inflammation in your vagus nerve, and that can promote inflammation in the brain. Scary, scary, scary.
Vagus nerve is designed, it comes from an area of the brain that's designed to keep you calm and relaxed and digesting nicely. So when the vagus nerve stops working, you go into kind of, survival mode. You might know it as fight or flight. And then you have this mechanism that you're talking about. You have all stress, you have stress hormones that start firing off, which affect that left midbrain that you're talking about. And at that point, just perpetuates all the inflammatory responses.
Stress hormones now unequivocally have been shown to keep these brain immune cells, like Dr. Rutherford now, activated to keep staying fat and pouring out inflammation. Stress by itself. And then we have inflammation per se in the gut. Who hasn't heard us talk about the gut?
Now your gut's not working.
In one of these broadcasts. And that directly can activate neurological pathways that inflame your brain. Then we did a whole broadcast on leaky brain syndrome, where pieces of bacteria from the intestines can get into the bloodstream, and then those can go into the brain and they can actually damage the blood-brain barrier. So the blood-brain barrier is your blood vessels that go into your brain. They should have a tight dam-like appearance around them, but they can start to open up like Swiss cheese, dramatic example, and now inflammation from the body can now more readily pour into the brain as well.
So to bring this down to practicality, if you have a concussion, you probably have violated the blood-brain barrier. That blood-brain barrier is supposed to keep everything out of your brain that doesn't belong there. If you have that and you have the effect on your gut from this brain, from this vagus nerve thing, that gets, like he says, that gets porous. Now stuff that's pouring out of here, that's not supposed to be getting out of here. It's not supposed to get out of your gut. It's supposed to be going in the toilet, is getting into your bloodstream. That's going through here into your brain. And one practical application of this is you're probably a very cheap drunk. You probably can't drink 2 drinks without being totally wasted, because this affects your cerebellum and it affects other parts of your brain, and it affects inflammation and it affects blood sugar. And this is the beginning of the practical aspect of what we're going to be talking about as to what can be done in help preventing further brain damage as we go along. For example, I don't drink.
Exactly.
Period. I don't eat gluten. We're going to talk about that probably a little bit, because it's the most inflammatory component to your system, because that gets through this gut and it gets through that blood-brain barrier and it messes people up who have concussions big time. And we're going to talk about blood sugar and things of that nature over the next few minutes.
Exactly. Let's go to blood sugar. So
here is how you prevent further brain damage once you've got it. And I got to tell you, I don't know how many people have it. I said to Dr. Gates before we did this, I said, the problem's probably a lot bigger than most people even realize. And he said, well, you're unusual. And I said, I don't know that I am, because in a lifetime, in my chiropractic lifetime, when I was doing strictly musculoskeletal work, I did a lot of injury work. I did a lot of back injuries, but I did a lot of neck injuries. And when they would get neck injuries, particularly, I'd say, have you ever had a concussion? It was amazing how many times people say, yeah, I had this one. And then I had that one. And then they'd come back on their 3rd or 4th visit and go, you know, doc, I remember when I hit my head over here, the one guy that I adjusted and got very dizzy, and we ended up taking MRIs. He had evidence of 7 subdural injuries. And once we started talking to him, oh yeah, I was working and I got hit in the head and I got knocked out, and I had a wall that fell on me, and I was walking up a stair and I hit my head on the beam and it kind of dinged me. And this one had a wall fall on me. You forgot that one. I had a wall fall on me. Yeah, I was out for about 5 minutes, but after I was okay. So it might even be a little bit more, there might even be a little bit more out there than what's going on. It's certainly not comparable to having 70,000 or hits on your head over a period of 17 years. But in retrospect, these people had the same symptoms, which is why I started asking them the questions. They were walking in the rooms, they couldn't remember where they were. They couldn't remember my name. They were forgetting their appointments. They lose their car and so on and so forth. So I think this is an important thing for everybody, really, to watch until proven otherwise. I suspect it's a little bit more. I mean, we're human beings. We fall. We hit our heads. You know, we fall sliding boards. The kids fall sliding board and hit their head on the ground. And as a kid, he doesn't know how to say, I got a headache, or he doesn't know to say, I'm feeling a little dingy, Dad, Mom. You know, I'm like, he's just like, hey, he's in a bad mood. Put him in bed, feed him. He's got low blood sugar. Yeah, this is just an observation. This purely anecdotal observation, but it's observation over a period of 30-some years. So I think it's something worth considering.
Yeah. So what we're seeing What they talk about in the literature is relative to what I'm talking about. Immune cells in the brain staying turned on, pouring out the inflammation. They're even talking about vaccinations. They brought up because the vaccination is turning on the immune system so that we don't get an infection, but it turns on the immune system. So that could keep what we term priming the microglia. Then we have infections. So could a massive infection trigger the immune system just stay turned on? They talked about heavy metal exposure. They talked about herbicides and fungicides, so chemicals used in agriculture that may be keeping this process turned on. What we feel wasn't highlighted well enough is this relationship to the gut, because actually when this article came out, I don't think that was really exactly known as well as it is now, to where pieces of bacteria from the gut going to the bloodstream can break down the blood-brain barrier, but also cause insulin resistance. So go back and watch our diabetes in the gut broadcast, because now if you develop insulin resistance, you start gaining weight. Fat is inflammatory. Fat becomes an organ unto itself, creating inflammation going throughout the body. Once you become insulin resistant, go back to our Alzheimer's and blood sugar broadcast, because once you're insulin resistant, there's this enzyme in the brain called glycogen synthase kinase, which turns on the machinery to start causing the Alzheimer's-like process that is now being seen. Glycogen synthase kinase is being seen in chronic traumatic encephalopathy. So if you are an athlete and you've been hit in the head several times via whatever mechanism, football, soccer, MMA, and then let's say you're 300 pounds, 320 pounds, 270 pounds, and you're overweight, that's a problem, because all that inflammation is now keeping those microglia from a probability standpoint turned on. Or let's say you have food intolerances that you don't know about and you laugh about, oh, that gluten thing is just a fad. Well, let me tell you, gluten has been shown in normal individuals to break down the gut barrier in one time. Normal individuals. It causes the gut to break down.
Eating it once.
And then pieces of bacteria can start absorbing it.
Not everybody, but if you breaks it down once, after you eat it once, trust me, it's affecting your brain because you're really sensitive.
Mm-hmm. And you may have a variety of other food intolerances. You may have autoimmune diseases that you don't know about. You may just have high inflammation. We may seem fanatical about this, but we're only so passionate because it's like we see what the problem is and we see how it can be prevented and it needs to be talked about. We're not saying we have the absolute solution there, but what we're saying is that we have a lot of data here to make a great argument as to why, if you've played these sports, you need to really pay attention to the things that we just talked about in the last couple of minutes, because it could be the difference between you getting better or worse. How do we know that? We've worked with concussion patients who have had a lot of concussions, going downhill. We implement these strategies, all of a sudden their lives are changed. They can think better now, they can think clearly. They thought they were going to get Alzheimer's in a few years, and now they're not.
We see it a lot. So is that it? You done?
That's it.
Wow. Okay. So the summation would be, from the practical aspect of it, if you have these types of things that we talk about, if let's say you have a poor diet, let's say you have a bad gut, let's say you're a very highly stressed person, when you get these injuries, you're going to be susceptible to having a lot more problems with it. We're not here advocating to stop all sports. We just know they're not going to stop. We're advocating for them to stop. Maybe there should be kind of something you sign and say, look, I'm aware that this is a possibility, so that you go into, at least you know. I don't have a problem with that as long as people know. But if once you get an injury and you start seeing some of the symptoms we have, if you have a bad gut, in other words, if you have diarrhea, vomiting, you have diarrhea, constipation, you have bloating, you've been diagnosed with irritable bowel syndrome or celiac or something like that, that is going to be affecting this situation. That is going to be affecting your brain. If you have pre-diabetes or diabetes, that's going to be affecting your brain. If you have chronic stress, that's going to be affecting your brain. If you have any of the food sensitivities that Dr. Gates alluded to, particularly gluten, but there are other large ones, and you could develop food sensitivities that would blow your mind to know what they are. Any food sensitivities that activate your immune system, that's going to mess it up. If you have chronic viral infections, if you have Epstein-Barr virus, if you have Coxsackie virus, if you've been diagnosed with Lyme, you we do look at our Lyme presentation, okay? But these things are going to affect your immune system. They're going to perpetuate this inflammation in the brain. If you smoke, your brain needs, aside from the chemicals that it sends to your brain, if you got a leaky blood-brain barrier, if you smoke, your brain needs oxygen for all these things to be able to heal. There's something in your brain called mitochondria everywhere. If you don't make enough energy, you do all this other stuff, you can't heal if you're sucking all the oxygen out of your brain. If you drink alcohol, you should stop, period. Not 1 a day, not 2 a day, none a day, none. For this, none, 0, none. Then somebody's going to say, well, can I have red wine? That's good for you. No, none. It's bad for your brain. And too many drugs. And unfortunately, that is kind of the approach. And I'm not criticizing that approach, because that is the approach for someone who walks in and has all of these symptoms. They showed it they take it to extremes in the movie, but they were trying to make a point where the gentleman, he continued to go to the team doctor, and the doctor would give him one drug for this symptom and a drug for that symptom. In this particular case, the guy was having hallucinations and he was feeling poorly. He just gave him a shot to put him to sleep. There is such a thing called polypharmacy. Polypharmacy is something that will affect this too. Those, to the degree you can get those under control, to the degree that you can get those under control, your brain can respond well to the types of therapies and exercises and strategies and stimulations that a functional neurologist would perform. But you got to do both. You can do those exercises from now until doomsday, but if you're feeding it all this bad chemistry and you're creating bad chemistry, it's not going to happen. But it can happen, and that's how it can happen, and that's what you kind of need to be aware of. That if you're suffering from these things, there is a way. There is a way. Don't let everybody tell you it can't be done. You just need to find somebody who can do it. And there are a lot of, well, I don't know. You just need to. There's the internet. There's us. There's that. There's this. I don't know about us. We said like 17 new patients call yesterday. Did you know that? Was it like 17? So and so we're trying to. We made the mistake maybe last week of saying we're open for business, but you can contact somebody who is probably going to be in the field of functional neurology. Somebody's in the field of functional medicine, but if you contact somebody in the field of functional medicine, make sure that you interview them to find out that they're conversant with this, because this is a little bit more of a complex issue. There's a lot of moving parts to this, but if you know that they're there, like you now know, and you know how to evaluate them all in that person and find out which ones may be the ones that are the big players and calm them down, you can be a lot better. You can be a lot better. So, okay, so I think that's it for this week. And then we'll try to come up with an interesting subject that may be a little less sensitive and a little less controversial next week. But, we talked about it. We felt compelled to do this on hopefully as objective a level as possible. Again, please don't bother to write us and tell it. We're not trying to get rid of the football leagues or anything like that. We're not. We're trying to let people who are out there, who are sick, think they have no hope, are ruining their family relationships, that whole thing. We're just trying to let them know maybe there's a way. Okay.
Exactly.
See you next week.
All right. Thanks for watching.